Hi, everybody. Welcome to the YMCA Education Series. Today we have Denise Schwartz. She's a physical therapist and owner of the Manual Touch. Denise is here today to talk to us about how to heal shoulder pain in a natural way and all the ins and outs that go along with it. And on behalf of the YMCA, we thank you for being here, and I'll let you take it away.
Well, thank you, Amy. I'm glad to be here. I always enjoy doing these presentations. I am going to share my screen, so give me a moment. And then I'm going to hide myself and whoever else is there. You should still see my mouse moving around.
Yep.
You
Well,
can, looks good?
yep.
Okay. 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 So thank you, Amy, for having me. As she said, my name is Denise Schwartz. I am a physical therapist and owner of the Manual Touch Physical Therapy and Wheeling. We use a whole body approach of traditional and non-traditional therapies to get people doing the things that they love to do. A couple of years ago, my son Drew, there he is, who is now 28 and married. So a couple years after he finished college, he asked me to help him recover for some injuries so he could get back to triathlon racing. Uh, he began doing triathlons at age 14, and he soon began winning his age group in every race he entered, including competing at the junior elite level and then being nationally ranked when competing for his college team. After college, he had some injuries, so he took a couple years off to nurse his injuries and get used to adult life. And for those of you who don't remember what a triathlon is, it is a three-sport race where the athletes swim, then bike, and then run. Here is a junior elite start of a swim. So they all kind of jump in and land on each other. So he decided to re-enter triathlon racing at the Pleasant Prairie race in Wisconsin, and he would swim a half a mile in a small lake, then he would bike 12 miles and then run a 5K, which is 3.1 miles. So first I evaluated him by running on the treadmill to look at his running form. I provided him with some tips for his running form and some spot specific exercises. But most importantly, what I provided him with was encouragement and support to get him safely to race day and to encourage him that everything was fine. There was many a night I'd get a call, oh, my hip hurts, I can't run, or my calf hurts, I don't think I can bike. And I'd have to talk him off the ledge and let him know, either modify what he was doing or let him know things were okay and this is how we're going to do it. So it's really about managing his mental state as he's going through the training. Now, the Pleasant Prairie race was unique in that it attracted a lot of para athletes. These are athletes with disabilities. I saw athletes running with a prosthetic blade. I saw athletes biking with and without the prosthesis. I saw athletes being carried into the water because they couldn't walk, but they could still swim. Now, my son's rehab took about 6 months to get him race ready, but I can guarantee you that these athletes, these para athletes, it took them many years to get to this point. That when they first receive their disability, or even if they're born with it, their goals are not to do a triathlon necessarily. It's really to learn how to function in life with their new disability. So how to get up and move around, how to move around in bed, how to get dressed, how to get washed. But as they go along in their rehab process, these para athletes at some point accepted their disability and they created new goals, larger goals. And they created a triathlon goal. And you never quite know what you can accomplish when you don't let your disability, your limitations, your injuries to define you, because you never know what you can accomplish. I receive no greater joy than when my patients come to see me and they create these larger goals and then they achieve them knowing where they came from. Now, maybe your goal isn't to do a triathlon. but you just want to be out of pain. You want to be able to walk without pain. You want to golf, pickleball, tennis without pain. Or maybe just everyday activities you don't want to have pain. Sleeping, standing, cooking, hanging out with your friends. So today we're going to talk about shoulder pain. And we'll talk about the 3 common diagnoses that I typically see. We'll talk a little bit about the anatomy and how the shoulder works, and then what you can do about it. Now, if you have any questions, go ahead and put them in the chat box, or hold on to them, and we'll answer them at the end because I can't see you. So, common complaints when people have shoulder pain. They can't, the shoulder wakes them up at night. They can't lay on the painful shoulder. Sometimes they can't lay on the other side. So they can't lay on their side at all. They can't lift overhead. They have difficulty getting dressed, washed, shaving, putting on deodorant, doing their hair, opening and closing a door, putting their hand in their back pocket, and they can't do their favorite activity, tennis, golf, etc. So the 3 most common causes of shoulder pain that I see in my clinic is a tendonitis or an impingement of the rotator cuff or bicep tendon, adhesive capsulitis, commonly known as a frozen shoulder, or arthritis, also known as degenerative joint disease. So here's your skeleton, and here's your shoulder complex. And you can see, I show you the skeleton because I want you to see how everything is connected. That anything that might be happening down here might affect what's going on up here. Anything up here could affect what's going on down below. As you can tell, these dancing skeletons, if there's something going on in their feet, then everything above it has to adapt to that. And, even though we're talking about shoulder pain, it could be because something's going on down in their feet or their hips, or more likely their core, which we're going to talk about in a moment. This is your shoulder joint. So this is looking from the back. This is your scapula, commonly known as your backbone. This is your arm bone, the humerus, and the humeral head is a ball, shaped rounded like a ball, and it sits in the socket of the scapula called the glenoid fossa. So this is called the glenohumeral joint. So that ball, the arm, moves around inside that socket. And it's a very mobile joint. It's a very unstable joint. It's very easy to get injured. Let me point out this one other joint up here. This is your clavicle, your collarbone, and it also connects to this part of the scapula, and it's called your AC joint. That's the acromioclavicular joint. The scapula sitting on your rib cage is called your scapulothoracic joint. And so when you move your arm, this scapula moves in rhythm with the humerus. When people are injured or they have pain or something's going on here, one of the primary culprits is this rhythm is thrown off. The muscles around the scapula aren't doing their job, and the muscles around the joint here aren't doing their job to stabilize, so it keeps that humeral head in the socket. This is a front view of your shoulder joint. Okay, so you can see this is the inside of the scapula in front, and in front here that's cut off is your rib cage, your clavicle, the AC joint, and there's the glenohumeral joint. So the rotator cuff is 4 muscles, and it literally sits like a cuff over that ball. Okay, this is the posterior view, meaning you can see this from behind. So there are 2 rotator cuff muscles that go across the back part of the scapula onto the humerus. So you got 2 of them here, the teres minor and the infraspinatus. There's one that goes on top of the scapula over onto this humerus called your supraspinatus. And underneath, between the scapula and the rib cage, is your subscapularis. So these 4 muscles act as a cuff. So when that ball is rolling in the socket, it holds it in place. Now, when that rhythm is off, so this moves too fast or the muscle here is so weak and people start shrugging their shoulder, then they get something impinged in these bones. And that's where you get the impingement and the tendonitis. These tendons get inflamed. Another important component of the shoulder is your bicep muscle. This is the long head of the bicep. There's two pieces of it. That's why it's called bi. You have a short head and a long one. This long one comes up here and it attaches onto the humerus up here. And this can get inflamed as well and impinge. So we sort of have to differentiate, is it coming from the rotator cuff or your biceps? This is just another posterior view of the rotator cuff on the backside. I have an ebook that can help you learn how to function through your daily life so you don't get irritated here. And if you would like me to send you this ebook, just leave your first and last name and your email in the chat box. A component that can set people up for injuring their shoulder is your posture. I don't like when a lot of people come in and tell me I have bad posture. I don't think anybody has bad posture. Posture is just who you are. Your spine and your skeleton has just changed, whether through puberty or over time. Things just change. It's no fault of yours. So I don't ever want to say to somebody that they have bad posture because that indicates that it's at their fault, and it really isn't. However, when your spine changes, so here's a normal spine where you have a curve in, curve out, and a curve in, and your shoulder sits over your hips, over your feet. As people get older, particularly, let's say if you're osteoporosis, you might develop a larger curve back here. This would be more of a osteoporosis where you have a larger curve here and a flattening down below. And you can see how your head has to change to adapt so you can see. And if you can recall, those scapulas sit on top of this thoracic spine. So if your spine rounds, then that scapula has to come forward. And if you can picture that scapula comes forward, it will pull the shoulder, the whole shoulder comes forward, you're rounded. So then when you go to raise your arm, there isn't as much room to raise. So you can't raise your arm fully over your head. So if I get here and I'm really hunched over, this is as far as my shoulders can go. But if I sit up straight, then the arms can come all the way overhead. Does that make some sense? So it's very important to look at, where is that shoulder blade sitting and your spinal alignment in shoulder play. And if any segment is a little bit off, something can throw you off, right? Primary issue for most people with any pain problem that they come to see me, whether it's their shoulder, their hip, their knee, their foot, it's usually because something here in your core did not do its job. And we could even consider that scapulothoracic rhythm as your upper back core. So if this isn't working, and if down below is not working, you got yourself a problem. Then the shoulder is like is kind of rudderless. It just can't function the way it needs to optimally. So your core muscles are every abdominal muscle below the diaphragm, in between down to the pelvic floor. So it's everything in front and everything in back as well. These pelvic floor muscles are very important to help stabilize your pelvis. You have muscle that attaches to your arm that attaches down on the pelvis. So that plays a role. So again, if everything is kind of shortened up, you can't raise your arm up. So we need to get in here and get this all working together. So how do we know what's really going on? So these are pretty typical when someone comes in to see me. I'll ask them some questions. When you have pain, how does it hurt? And based on those answers, we can get some general idea of probably what's going on. So if you have a rotator cuff tendonitis or an impingement, usually people will say, as I raise my arm up, it hurts here. but then if I kind of wiggle, I can get above and it's okay. So they can kind of move from here to here, or they can move from here to here, but they get stuck or impinged at a certain point. It may hurt to lay on that side. They can't really do overhead movements safely. It hurts, and they'll have weakness. To differentiate that from a bicep tendonitis, usually a pulling motion or picking up motion. So pulling up your pants, reaching into the back pocket. When I poke right onto the bicep tendon, that's very tender. Okay. So, and then I have noticed that if I have people lean on their hands, that hurts the bicep tendon. If they have the rotator cuff tendonitis, they lean on their hands, it's not so bad. A frozen shoulder or adhesive capsulitis is literally, I can't raise my arm, I can't reach behind my back. There are phases of the frozen shoulder. When it starts to freeze up, and what that means is you develop adhesions in the joint, it's usually very painful. Uh, Quite often people have an injury in their shoulder that they may not know about, or they do, and they kind of protect their arm, and then they develop these adhesions. I don't think we really know why you develop them, but we do. We do know that it happens more in women than men, and it usually doesn't happen until over age 40. Once you get through that freezing stage where it's really painful all the time, then it only hurts at the end range. Like, I'm just stuck. I can't go any further. This is fine. I can do this. But when I hit that end point, it hurts. Um, so that's more of that plateau phase. And this is where we want to see you in therapy, because this is where we can start making a difference. And then at some point, if you don't do anything, it will thaw out over time. Over a couple of years, it should get better, but it can take a long time. And the best course, the best way to move this along is physical therapy. The third common diagnosis is arthritis. That's where you get degeneration in the joint. And the best that we can do, you can't really push people to do much. They usually have a lot of weakness. They have pain with certain movements. And so we just want to keep people functional and make sure they keep some quality of movement without overusing that arm or really overusing too much weight or strengthening. So you got to be careful with people with arthritis. So I had a patient come to me, Jennifer, and she had had a frozen shoulder and she had gone somewhere else for therapy. No, wait a minute. She didn't have a frozen shoulder. She had a rotator cuff tendonitis. And she went for therapy, I don't know, for a few months. And she was about 80% better, and they discharged her, and it never was quite better. And I think she came to one of my talks. And so she came in to see me, and I decided it was her bicep tendonitis, and they sort of had missed that component. So we fine-tuned her training and her rehab, and she got better, and she could finally put on her shirt and was pain-free. And when someone comes in and they tell me that they have a shoulder pain, we have to discern if even if they've been to the doctor or not been to the doctor, sometimes that pain is coming from not the shoulder. It could be coming from their neck, or I get people who have rib cage pain, the intercostal muscle, and then they feel like a radiating pain down their arm as well. I can't quite explain that, but I have seen it. And once we take care of the intercostal muscle and the rib cage, that arm pain goes away. So Lynn is a 78-year-old woman, and she had really debilitating neck pain for many months, and she was seeing a chiropractor and a massage therapist for 4 months. It didn't get any better. Nothing they did help, but they kept plugging away. Note to self, if you're not getting anywhere after 4 to 6 weeks, it's time to do something different and get another opinion or move on. She had an MRI of her neck and it was insignificant. But she came to see me and I evaluated her and it appeared it was her neck. And I did 2 sessions with her, settled down her neck pain. And then I looked at her more closely and I realized it was actually coming from her shoulder. And she had a significant rotator cuff tendonitis and a tear in there. So what was happening was every time she used her shoulder because it was weak, so weakness in the arm could indicate, something going on in your neck. Because she had so much neck pain, they thought it was her neck, but nobody looked at her shoulder. At any rate, what she was doing in order to use her arm to live, she probably was overusing her neck muscles up in here and jacking that up. And so she was straining all the time, every time she moved her shoulder. And that's why her neck was so flared up. So her therapy changed to shoulder rehab. And it took a few months, but the neck pain had settled down. We taught her how to move and function throughout the day so she wouldn't aggravate her neck as she worked on getting her arm stronger. And I haven't heard from her in about a year, and I think she's doing really well. The inevitable, aging. We all age, and we all go through the same thing. As we get older, probably, well, I mean, aging process and degeneration starts pretty early. However, it really starts to accelerate probably over age 40, 50, 60. You start losing some muscle mass, bone integrity, which then and the flexibility of your tendons, everything is tightening up and you become a little more rigid. And as a result, your balance becomes less, you become weaker, and you become more at risk for falls. And I get people in here, I have to explain this to them a lot. People are really concerned, I can't do what I did 10 years ago. People have an identity crisis. They want to be able to do what they used to do, but they have a new body. It's been changing. So it's really important to embrace that aging process and don't let it limit you, but understand what you can and can't do. So here's one of my favorite people, one of my friend Carney. He's 73 years old and he still does triathlons. And I think a few years ago he was still doing marathons, but I think his marathon days are over. These ladies didn't let age interfere with their life at all. I met these three women standing in line at this Tampa Starbucks. We were all there to do the half marathon, the Gasparilla half marathon. And this was the day before the race. We were all there to get our race packet. And they were standing behind me and they already had medals on them. And this one lady you can see had a happy birthday headband on. And I said, why do you have medals already? So they had already done the 5K. They walked it. They walked the 5K. They were going to walk the 10K later on. And then they were going to walk the half marathon the next day. These women were ages 70 to 80 years old. I believe this woman in the middle turned to 80 that day. They had a long-term goal, which they did complete a couple years after I met them, to walk across America. They started in Jacksonville, Florida. I think they put their toe in the water and they walked to Texas. I think it took about 4 months and they had a whole system. Somebody drove the van. So, so it was sort of a cumulative, everybody walked some of it. They took a break for a while and then they went back to mid-Texas and they walked the rest of the way to San Diego. So these ladies didn't let age interfere. They kept up with stuff. They embraced where they were with their age and how to work with it. So I hope that you can embrace something, some big goal like that. That's a really large goal. I'm not sure that that's really important to get to. Anyway, I had a woman named Debbie, a friend of mine, come to see me. She had fallen. I think she fell over her dog. It was cold outside, ice, whatever. She landed on her arm, and she's a tennis player. And so she had some rotator cuff and bicep tendonitis, and she couldn't play tennis. So in addition to really kind of settling down the inflammation, we needed to retrain that scapulohumeral rhythm that we talked about in the beginning. We do what's called neuromuscular reeducation, really retraining your body to work together. And for her, it's a whole body approach. We got to get, her legs integrated with her core and her arm. Think of a baseball pitcher, right? They can't throw that ball at 100 miles an hour with just their arm. They got to use that big butt and core and legs of theirs to transfer all that power up to their arm. Doesn't matter how old you are, we still have to do that kind of training to get everything to work together, which we call neuromuscular reeducation. So what's the biggest mistake people make with shoulder pain? They ignore it. One of my best friends, Amy, she lives in Florida half the year. She's a retired teacher. And I was going down to visit her in January. And she said, my arm has been bothering me. Can you take a look? She never asks for help. So I knew something was bothering her. I took a look at her and I said, "Oh, you have a frozen shoulder." I gave her some exercises, and it hurt her to play pickleball, so she had to stop. And so I gave her some exercises to do. And I said, if it doesn't get better with this on your own, since I didn't live there, you really need to go to PT. So she didn't talk about it much. I didn't ask about it over the next few months. I talked to her again few months later. I said, "Oh, how's pickleball going?" She goes, "I haven't been able to play. My arm still hurts." I said, "Oh, you never went to therapy?" She goes, "No." She goes, "No, I decided to wait till I come back to Chicago to see the doctor." Instead of admonishing her, I just kind of went, "Oh." It was a shame because if she had gone to therapy, she would have been playing pickleball. She wouldn't have been 100%, but she would have been able to still play. And now she's going to come here and the doctor's going to send her to physical therapy because that is the treatment for a frozen shoulder. And in fact, any shoulder pain, almost all the time, you will be coming into physical therapy to help with your shoulder pain. You might get a shot, and we'll talk about that here. You might get a shot, you might get some anti-inflammatories, but well, the ones who see me, they don't want to do surgery right away. They want you to come into therapy to see if we can handle it and get you better and stronger. Some people ultimately do need surgery, and that's okay, but we can get you stronger. So, how do we know if we can help you? Well, if your pain is reproducible, and what does that mean? It hurts when I hit this point, but if I do here and this, that's fine. It hurts when I lay on my arm, but when I'm working on the computer, it's fine. What is not reproducible? A number of years ago, I developed some back pain. It didn't bother me while I was running. It started getting worse each day, and it started traveling around to the front of my abdomen. And I couldn't find a comfortable position, and I couldn't find anything that reproduced the pain. It was like nothing made it worse or better. So I knew something else was wrong. I ultimately found out I had shingles. I had pain before the rash showed up, so it was hard to diagnose. Sometimes shoulder pain does mean is being referred from somewhere else in your body if we can't reproduce it. So we really need a doctor to assess you. So what happens when you come into physical therapy? We evaluate you. I take a look at your walking. I take a look at your mobility and your strength. We poke around a little bit and we sort of kind of look at all those little pieces. So you're like a puzzle. First, your story is one piece of the puzzle. When does it hurt you? How did you get injured? Um, what other issues have you had in your past? Have you had surgery? Somebody have had scar tissue anywhere in their body, it could be limiting your movement. So we sort of look at you as a puzzle and we take all those pieces together and we figure out a treatment plan uh, to get you better. So what are we going to do? We might do some hands-on work called manual therapy. That's where we make sure all your joints are moving optimally. We make sure all the soft tissue restrictions that might be preventing you from moving the way you need to. And we use some non-traditional and traditional manual therapy techniques for that. Um, the non-traditional means that we're working a little bit more with your body. It's a little bit more delicate. You may not feel it as much. Traditional would be a little bit more deeper and a little bit like a real deep tissue massage. We give you the right exercises, and we have to sort of figure out where do we begin to do those exercises. Usually, we need to get get your core working and your feet connected to there, so your shoulder has a safe place to sit on. We do a lot of education to teach you how to optimize your posture and function and movement. We really get everything working together called neuromuscular education. And most importantly, education and how to move and how to function throughout your life. How to sit, how to stand, how to walk, how to sleep, get you in the best position so you don't keep aggravating that shoulder. And then if you have a goal to get back to certain activities such as pickleball, tennis, golf, etc., we go over and we come up with some specific things to do for that. One of the tools I've added into my practice in the last 5 or 6 years is an OOV. This is a wonderful device created by an Australian osteopath and a biomedical engineer. And it's designed to work your body three-dimensionally so you can't compensate. You can lay on your back. I can have you standing with it between you and the wall. I can have you standing on it. You can see here's an older gentleman doing a standing exercise, and here's my son doing a much more advanced exercise. You can lay on your stomach, on your side. We can sit on it. You can do all sorts of things. And it teaches your body how to function subconsciously so you don't have to think about it so much. It's also an ideal tool to get you to diaphragm breathe, to really learn how to breathe the most optimal way. He created a second device during the pandemic called a balance sit. And it's for sitting because we were sitting a lot during the pandemic. And this again activates your core and your pelvic floor subconsciously. And it really teaches you how your core to integrate with your hips and your upper body. Here's a friend of mine sitting on it. And she's got one foot up and she's learning how to stabilize on her left leg. So my son completed the Pleasant Prairie Triathlon. He got 8th in his age group. The time has passed where he wins his age group, but he ultimately trusted his healing process and he embraced his healing journey and listened to me at that moment. And you know what? I hope that you embrace your healing journey because you never know what you can accomplish when you embrace what's going on and where you are in your life, and accept that, the aging process may not allow you to do what you did before. Or if you have an injury, it doesn't mean that you can't still have a goal to accomplish some big dreams. So, as a thank you for today, I'm happy to give you a free phone call to discuss what's going on with you and give you some recommendations. If you leave your first and last name and email in the chat box, I can send you my tips for shoulder pain. I will give you one tip. When you go to use your arm, always use your body. So if you have to reach overhead to get a dish, make sure you turn. Let's say you're reaching for the seatbelt in the car. Turn a little bit so don't just reach with your arm, turn your body to get to it, okay? And you'll get some ebooks when I get your email. All right, I'm going to stop sharing this. And if you have any questions, I'd be happy to answer them.
Okay, I just want to know that I had a car accident in
Car
the May.
accident? Uh-huh.
Yeah, and my shoulder, it's not that bad, but I still have like here, from here to here,
Yeah.
and not like certain point, but like daytime, I do some exercise, and I'm okay. But when I sleep in the morning, it gets worse. So something in sleep, and I sleep most of the time on left side, but
Okay.
pain is on right side.
Yeah. So, you could try putting a pillow under your arm, or if you wind up laying on
Which
that.
arm? Which arm? Like
Well, if you're laying on your left side and your right arm, so you put a pillow under your right arm.
right,
Here,
right
you kind
arm.
of hug a pillow. That might be helpful. When you lay on your side, make sure your shoulder isn't shrugged up. You want to kind of pull it down. Okay.
Hmm.
But
Yeah,
you
this
got
side
probably,
I
huh?
sleep more this side, but I don't have pain this side. I have pain this side.
When you lay on the left side, does it hurt your right side?
Yeah.
Yeah. So try putting your arm on a pillow and see if
Okay.
that helps.
Under.
Yeah, yeah, yeah. So it's kind of like between here.
Okay.
But you probably, were you driving? Were you the
I'm
driver?
driving, but I have my car right now in repair, so
No, no, no.
I'm
Were you
using.
were you the driver when you got hit?
Yeah.
Yeah. So, if you're the driver, things can get kind of jammed up in here.
Yeah. And
This
my
these
car
muscles
bump.
get strained.
Yeah, my car like got hurt more on passenger
Um,
side.
yeah.
So that's
So,
why
we
I
can
have
help you
a.
get kind of relieve these muscles and make sure you're not overusing them by shrugging your shoulder. So you need to kind of learn how to move so you don't keep irritating it. It may not be in the
Okay.
shoulder joint, and it could just be the muscle that goes from your
My
head.
doctor said that I went in emergency room. They took some X-ray, and they said there's no fracture or anything, but they say arthritis.
Well,
don't know.
it's things are strained around there, so you could be.
But do you take like I have Medicare,
Yeah,
Aetna,
yeah.
do
I
you
take
take
I
any?
take Medicare. You just need a.
I have PPO. I have PPO plan, Advantage plan.
That's fine. We
You
check
take
your
that.
check your benefits, but if you're Medicare, that's not a problem. And but the doctor needs to approve it, so you just have to get a prescription if you're Medicare.
Okay, one more question that my doctors write me for physical therapy,
So you're set. Just give
but
my office.
you are not in a North Shore, right?
No,
Endeavor.
no, no. I have my own practice.
Yeah, so I don't know. I
No, it's
can
fine. If you have
go.
Medicare, it's fine.
And another thing, they told me to go like uh, what was
You can
that?
go wherever you want.
Oh, for my car accident, I have some coverage from
Oh,
medical
and so
coverage.
yeah, so yeah,
So
yeah. So
you
if
can do that. You can like send to.
yeah. So
Uh,
if it's a car accident and the car accident is covering the medical bills, then my biller takes care of that.
yeah, because I have 5,000 coverage, and I already used 1,000 something because I went in emergency
Yeah,
care.
if you call.
So now I have 3,000 something still left, and they say give your claim number, and they can send that to
Yeah. So just if you
you
call my
can.
office, Jenny, my admin, can talk you through that process and let you know.
Okay,
Okay.
can you send me all the contact information and everything in there?
Well, it was on the PowerPoint, but if you, I'll tell you my phone number.
You can send me email.
Yeah, if you left your email in the chat box.
Or,
I don't know where it's at.
if you'd like, I can share your email address with Denise. If you just verbally
Okay,
agree, I can do that and connect you too.
okay, okay. And you are in Wheeling.
Yes,
Okay,
I'm at
okay. I live
Milwaukee
in.
and Dundee, so it's very easy.
Oh, okay. I live in Buffalo Grove.
There you go.
Very
Okay.
close.
And you got
Yeah.
construction everywhere in Buffalo Grove, so.
At least I want to get some advice.
And I have another
It's not.
therapist here, so
Yeah.
we work together.
Okay. But do you, if you are not in network, still it cover, right? My insurance.
I'm sorry?
I'm in Endeavor network, but still it's okay with Medicare.
Yes. Yeah.
Okay.
But my admin can help you with that.
Okay.
All right. Well, thank you for
Okay.
coming.
Thank you. Thank you.
Something I didn't touch on is when people they ultimately need rotator cuff surgery. People are doing much better than when I started 30 plus years ago. And they're doing very well with it, even if they're older. I've had people in their 70s have rotator cuff surgery and they do really well. It is a very long rehab process. I see people a good 4 months or more after you have surgery, and it's not very pleasant the first 6 weeks because you're not allowed to move your arm, but
Oh,
people do very well with it. So if it's really miserable and you can't function, then, and if that's something the surgeon is recommending, then um, people do well.
Yeah, you can share my phone number and my email.
I'll make sure to send that for both you guys to have. And then Denise, I have a
Okay.
quick question about
So
from
I can
when.
leave now, right? I can leave now.
Oh,
Okay.
sure,
Thank
that's
you.
no problem. Thank you, Vina.
Okay.
Bye.
Oh, I had a good question too.
Okay.
But I do have a question. So just from when one person goes to you and you realize, oh, it's their rotator cuff, at what point do you say, I think that this is not working and you're going to need the rotator cuff surgery? Is it after 6 months of therapy, or are you
Oh,
able to, it seems like your plans are very individualized, so you really
Yeah,
know
it's,
the
it's very
person.
individual. I think if it gets to a point where people are in pain all the time, they really
Mhm.
just can't do anything. It's just achy. If if the pain is just not getting abating after about 8 weeks at least, I think we usually like to give it a good 8 weeks or more. And
Mhm.
sometimes the surgeon, based on the MRI, if it's a pretty significant tear, they're like, we're not probably going to get any better.
Yeah.
However, they still like you to do therapy so we can get everything else working together. And there's
Mhm.
usually things we can work on to get your body better prepared for surgery. So usually a good 8 to 12 weeks is a
Yeah.
good trial, unless you're, really just miserable. So.
Mhm. It sounds, I was going to compare it to knee surgery, but knee surgery, you can move they encourage the movement right away, but
You
with
know, the
tough.
knee, people can live with knee pain way longer without a problem. The shoulder and the hip are very unstable joints because they're ball and socket joints. So
Oh,
they
okay.
can go three-dimensionally and move all different ways. The knee just goes like this. It's a
Yeah.
hinge joint.
Uh-huh.
So people can function on a straight leg,
Oh,
they don't
that's
bend
right.
it. But the shoulder and the hip, when you need surgery, like the hip, when you need a total hip and
Hmm.
you're in pain, there isn't anything that we can really do for in therapy,
Oh,
particularly if they're really having significant amount of pain. If the pain isn't too bad and manageable and it's intermittent, then we can get you stronger and ready for hip surgery. Um,
hmm.
but I do find that when you need a total hip, it's time. The
Yeah.
shoulder, sometimes people can milk that a lot longer other than the
Because you
hip.
got two of them.
Yeah, yeah. Well, you're always on both
Oh,
both
yeah,
legs.
that's true. Your hips. Yeah. Yeah.
Yeah, so the
True.
shoulder, you can baby it and, but yeah, it's pretty miserable when people really need it, so.
Yeah. Oh, well, I'm glad I'll connect you guys. I'm glad she was able to come and get
Yeah,
some help and advice from you.
good. Well, thanks. Well, thanks for having me, and
Oh,
I'll
thanks,
see you
Denise.
next
Yeah.
month, and
Yeah. On
bring a
the
running talk.
17th, I'm excited.
All right,
I'll
take
talk to you
care. Have a
soon.
happy summer.
Thank you, Denise. You too.
Okay,
Bye.
bye-bye.